Our first speaker, Avi Dimitriadou, a founder, leading instructor of yoga therapy Greece, one of only 4 yoga therapy programs in Europe accredited by IAYT. Please visit IAYT.org/global yoga therapy day for a complete bio. Without further ado, Avi.
Hi. Thank you. Thank you very much for the introduction. Thank you very much for the invitation. It's really an honor and a pleasure to be here to this event, very important event, and try to share a few things that we shared there. Yoga therapy training in the first and second year of the yoga therapy training regarding trauma and how to befriend trauma. Trauma is a part of human condition, as we all know. Life is full of big or small traumatic events. The majority of people, 74% of women and 81% of men, will experience a traumatic event in their lifetime. Still, trauma doesn't have to be a life sentence. Trauma affects the individual's physical, emotional, and mental functioning can be restored to balance by befriending, by accepting trauma as part of life. Suffering can lead us to solutions, to discover why we're suffering, and ways to handle the effects of trauma. The denial of trauma promotes and prolongs the suffering, while acceptance, as we know, unleashes energy and wisdom. It empowers us. Befriending trauma is very important, and knowing that trauma is part of life obviously is not enough. The goal is threefold: to achieve recognition and understanding of either the uncontrollable emotions, the overwhelming emotions, or the rigid logic. To self-observe and compassionately understand and accept the self, ourselves. And to commit to self-care practices that enhance the well-being, including a sense of balance between emotions, thoughts, behaviors, and interpersonal relationships. But what trauma is really? Trauma means wound in Greek. Trauma is a result of events that exposed us to violence or death, that threatened or violated our physical, mental integrity, our safety, or deprived us from basic rights and nourishment. In few words, trauma is a person's psychosomatic reaction to a frightening experience that can occur at any time in a person's life. It hurts. Trauma hurts when it's open. It's very sensitive to touch. And whatever or whoever touch it triggers reactions. Over the wound, there's a scar tissue. It's not flexible, it's rigid, and we may not be able to feel the area, or even remember the trauma, or even to feel the wound anymore. It's usually what we are afraid of, or what we are ashamed of, or even not being able to remember anymore. It's the present-day imprint of the past pain, horror, or fear that lives within us, experienced in here and now. Trauma is the result of something done or not done, such as being neglected or deprived of care and emotions, attentions. It's not a painful story we tell about something in the past. Trauma is not what happened, but what happened inside us due to that. It's not only what happened, really. It's what we hold inside us, but even more, what we hold inside us in the absence of others, in terms of lack of support, in terms of not sharing. The traumatic events can be collective, such as wars and natural disasters, or personal, such as sexual abuse or physical abuse. The three most common traumas for men and women are the violent death of a friend or family member, witnessing severe injury or death and being involved in a life-threatening accident, wars, falls, loss of loved ones, automobile accidents, even diagnosis of medical conditions and prognosis can be very traumatic, as we may know as yoga therapists. The trauma effects are many. Neuroscientific research shows experiencing repeated traumatic events alters brain and nervous system, causing constant scanning and perceiving threats everywhere, and as a result, experiencing higher levels of stress. Traumatic memories of past are imprinted in the limbing part of brain and seat of emotions. When we perceive threats, the instinctive parts of our brain are activated, and the age-old ways of dealing with dangers such as fight, flight, freeze, and submission are becoming the predominant behaviors. When these areas remain constantly activated without the activation of the prefrontal cortex, the brain's control part, our body is driven to chronic overstimulation. Our nervous system is in chronic overstimulation. As a result, we do not feel safe. At the core of our being is a profound lack of trust in the world. We see the environment as constantly threatening. So trauma brings disconnection from our body and from others as an effective protection mechanism to our emotional world. This connection is the wisdom of the body to make the unbearable bearable. But at the same time, it causes a loss of connection with us, our body, our relationships with others, with our potentials, with our spirituality. It takes away the feeling of belonging, the dissociation from our body, making us live in our heads, believing that knowledge, thinking will save us and make us happy, overestimating the power of the mind. The more we think, the less we may be open to feel. While the more we feel, the more we are aware. There's difficulty to follow our gut feelings as if we don't have access to them or we don't trust them anymore. Trauma takes the freedom from us, the freedom not to think through the trauma-conditioned mind. We don't respond to what happened, but to our perception blurred by perceived threats to particular upsetting memories of the past. Quite often there is a feeling of being stuck, which is a strong traumatic imprint. Thinking from a wounded place, we suppress our authentic feelings, try to control them. A huge amount of energy is spent to push down feelings due to trauma. As long as we feel traumatized, we feel alone, unsupported, or even hated by people who are probably also feeling alone, unsupported, or hated, or even too busy with their lives. We can feel isolated, actively rejected, or neglected, and we become self-focused, self-absorbed, withdrawn, depressed, fighting with ourselves. We often experience feelings of incomprehensible and overwhelming terror, rage, shame, and profound sadness, feelings that are not easily communicated. Especially in case of childhood traumas, the consequences can continue through an individual's adult life. The brain might undergo detrimental changes in its structure, resulting in the following functions being compromised: self-awareness, executive functioning, emotional regulation, rational, conceptual, and linguistic processing. Not only is there the physiological effects of adverse psychological experience on the young brain, but there can also be long-term health complications that come from repeated exposure to abusive experiences. The results of many research trials show a strong connection between adverse childhood experiences and future behaviors, such as violence, addiction, as well as devastating physical consequences, such as declining health, chronic diseases, and even low life expectancy. Adverse childhood experiences often lead to severe trauma and chronic PTSD. We know that PTSD is the post-traumatic stress disorder, a term that came from the American Psychiatric Association in the 1980s, and of course, obviously is included in the Diagnostic and Statistical Manual of Mental Disorders. PTSD, the post-traumatic stress disorder, symptoms are often thought as a common reaction to a traumatic event. The symptoms may not be attributable to physiological effects or of a substance or any other medical condition. Although 74% of women and 81% of men may experience trauma, as the research shows, approximately 11% of women and 6% of men will develop PTSD after a traumatic event. So most people initially develop post-traumatic stress disorder symptoms following trauma, and most recover with time. This is partly why the duration of the disturbance is considered an important criterion. The symptoms must be present for more than a month and cause clinically significant distress or impairment in important areas of functioning. And the main symptoms of PTSD, which are also the criteria of PTSD diagnosis, are exposure to a trauma. This can include experiencing repeated or extreme exposure to details of the traumatic events. Intrusion symptoms, at least one intrusion symptom associated with the event, and this has to be at the beginning, after the event. Examples of this could include distressing memories or dreams of the event, sometimes called flashbacks. Avoidance symptoms, this can include avoiding memories, thoughts, feelings, talking about the event, and avoiding reminders of the event, including activities, places, or people. Negative alterations in cognition, the way of thinking, memory, and mood. Examples of these would be not being able to remember an important aspect of the event or of that period in our lives, having persistent negative beliefs about the world, a negative schema about the self or others, and obviously the loss of interest in significant activities that we liked to participate, and detachment from others. Alterations in arousal and reactivity. This might include irritability or outbursts of anger, reckless or destructive behaviors, difficulty to concentrate, and hypervigilance. The factors for chronic PTSD are the factors that make us more vulnerable to develop chronic PTSD are gender. Women were more vulnerable to develop PTSD. The type of trauma, obviously, whether it's repetitive or aversive childhood experiences, and the recovery environment, whether there will be support, understanding, compassion. The psychological factors that can maintain the trauma effects and predict PTSD are the dysfunctional appraisals of the trauma or the after effects. For example, having these intrusions means I'm going out of my mind. I'm responsible for it. The trauma memory characteristics, for example, the memory is disorganized and lacks a coherent time code. Dysfunctional behaviors, for example, avoiding places that remind the person of what happened. Cognitive strategies, say suppressing thoughts related to the trauma. The person with PTSD experiences a strong sense of current threat, even though the trauma is over. The fragmented trauma memory contributes to this as a person experiences intrusions of the event. The person's increased attention to the threat is a strategy used by the individual to try and decrease the current threat in the environment. Instead, what this is actually doing is increasing the sense that there is a danger and prevents the memory from being processed and elaborated. Feeling safe and safety cues are imperative. So the therapeutic strategies for PTSD. Recent neuroscientific research warns that the information, prevention, and effective treatment of the symptoms of complex trauma, chronic PTSD, is an immediate health issue and an imperative social need. Science is now reconfirming the great effects of yoga and meditation, which gives us the great message of hope that there are now ways to heal the brain, the soul, and the body. As yoga therapists, obviously, we don't need to know the details about the specific trauma, but we work with the symptoms, with their needs, with their goals, with what they are ready to bring, where they are now. Going over the details of trauma may even re-trigger some feelings about the trauma, which is clearly unhelpful, unless we are also trained psychotherapists knowing how to work in this way. The trauma lives in our body, in our mind, in our brain. And that is why it must be healed experientially. Through our body, feeling the body again, feeling safe, feeling relaxed, feeling at ease. Through the mind and the brain, feeling heard, respected, understood, empowered. And focusing on what really need to feel, what we really need to feel. Focus on pleasant feelings and make pleasant memories. Focus in mind on what we can do instead of what might have been lost. The yoga therapy pillars for PTSD is first, the connection with compassion and understanding. A key therapeutic target for yoga therapy is for the people to feel heard, understood, valued, connected, and to make them feel safe, grounded, at ease with self-compassion, while gradually shifting the mind to a more sattva state, at least to a more neutral state, if not positive yet. We facilitate finding their purpose in life, their purpose in life, and whatever makes them feel nicer, safer, and at ease. What they might always love to do, and even gratitude for whatever this life has in store for us. And second pillar, as we may know, communication, enhancing befriending trauma as part of life and empowerment. Education about the trauma, about being part of life, and about the choices we have as to whether or not we let it characterize our life and it may let it ruin the rest of it, of our lives. Retrieve and remind them of their inner power, of their strong spirit that was always there, that supported them all the way through the challenges. The yoga therapy strategies are more specifically the slow and conscious breathing. And according to their breathing assessment and to their breathing pattern, we enhance the most affected value, the most affected part of breath and movement in the chest and the belly and the ribs, in order to establish a long and deep breath. Slow breath centered, mindful practice of asanas that befriend individuals with inner sensations. Yoga Nidra, inappropriate for the individual restoratives, according to their breathing pattern and to their structure needs, to release tension from the body and to make the breath effortless. Repetition of personally chosen positive affirmations that connect the person to what really matters to them and to what they might feel that they lack by reminding to themselves that they have it. And education about the trauma, about being part of life, and about the choices we have as to whether or not we let characterize or even worse, ruin the rest of our lives. So the education for befriending pain, for befriending trauma, part of the education during the compassionate motivational intakes, cues for befriending trauma can include trauma is part of life. We all have gone through traumatic events. Who we are is more than the traumatic events. The way we are feeling now does not define us, nor what is possible for us in the future. What happened is not our fault, but that doesn't mean that we cannot do anything for it. What brought us here is our inner power, our strong spirit that never abandons us. Wisdom is gained with losses and pain. We can change anything we face, while we cannot change what we cannot face. We can survive, revive, and even thrive by choices, by self-care practices, and by connecting. The trauma is in the brain, is in the mind. And through the brain, through the mind, we can heal it. Neuroplasticity reconfirms it. Let's choose what we think and do. Make space for grief, but also make space for joy. Honor what is lost and take care of what's left. Sooner or later, it will be a new wholeness. So I hope you have enjoyed And you have gained a few interesting elements that we share in our accredited yoga therapy training for trauma and how to befriend trauma. And I hope you would like to share, would like to join in a simple practice for self-managing the way we're thinking, the way we are acting, the way we're feeling after some traumatic or, let's say, not very happy events. So you can keep seated, stay seated with closed eyes or open eyes, feel comfortable. It will, and just think what thought, what emotion, what memory might be bothering you. What thought, emotion, or memory is playing in your mind. And where do you feel it in your body? And how do you feel it? As a restriction? As heaviness? Tightness? Emptiness? Fullness? Cold or warm? You may want to bring your awareness to your breath and to the part of the body that may feel restricted, numb, cold, warm, heavy, full or empty. And take deep breaths, feeling that part of the body being energized, expanded, balanced, taking care of your breath. Take 12 slow and deep breaths, feeling the flow, the warmth, the expansion through your breath. Take 12 slow and deep breaths, feeling the flow, the warmth, and the expansion to that part of the body that might feel restricted, numb, empty, cold, absent. And feel the effect of your breath in that part of the body. You may want to feel the body heavy and well rooted at the feet. You may want to feel your feet on the mat or on the floor, and you may want to say to yourself 3 times, I'm here. I'm here. I am here. And you may want to feel your pelvis heavy in the chair, on the floor, and say to yourself 3 times, I am safe. And you may want to feel your chest, your ribs, your heart, the upper part of the torso. And say to yourself 3 times, I'm open. I can breathe. Or what resonates more to you between I'm open and I can breathe, or both. Bring your awareness to the chest, to the heart, and feel the expansion as you say, I'm open. I can breathe. And you may want to feel the spots on our forehead between the eyebrows. And say to yourself 3 times, I am aware. I have access to my inner wisdom. And you may want to say it 3 times. And stay with the feeling of the feet, of the pelvis, of the heart, of the forehead. You may want to say to yourself, I'm here, I'm safe, I'm open, and I'm aware. And you may want to say again, I'm here with enthusiasm, with self-compassion, with awareness. I am here. Namaste. May you all be safe. Live your life with enthusiasm, with compassion, and with access to your inner wisdom. Thank you for allowing me to share with you what helps me, my students, and my clients. Thank you.
Thank you so much, Evie, for that beautiful presentation. We do have some questions. Heather asks, do those of us with personal trauma insights better prepare us to do this work?
Well, experience helps, but might lead us to assumptions and to projections, because every trauma has different effects, has different symptoms. So I think it helps to know that most of us are traumatized or have been through traumatic events. I think this helps a lot. And be experienced, I don't think there will be a lot of non-experience and not having experienced traumatic events. It's important to use the tools when, especially if we know that we have been through traumatic events, in order to be centered and grounded and not to be pushed or triggered by people that might carry traumas or might carry similar traumas to us and might trigger us. So practice our sadhana, practicing our meditation, practicing our pranayamas, practicing our tools will help us a lot. And knowing that trauma is there, is for everybody, avoiding the projections and the assumptions. Let's connect with the living experience and not assume that by having experience helps more or less. Compassion helps more than experience.
Thank you. We have another question from Madalena. Can you share your experience of helping someone who says they don't feel anything, or when they say nothing feels any different after you offer a practice?
It is nice to know how they were feeling before. I mean, if they were feeling something before and if there was a shift. So it's a matter whether there was a shift to neutral or positive, or there was an emptiness before. So this is a general tool that could help, that usually helps. If nothing shifts, then I would like to know more. The intake will give us more information about how to proceed. So maybe the breathing and the grounding was not for them at that moment, at that time, for this sensation that they might have, the feeling that they might have. So I would like to have an better interview, whether what they would like to share and how they would like to shift. This is a general practice for grounding, especially when people that do not want to open up, or they don't have the time to open up and they want a tool when things are like, they feel like things are shaking a lot, to feel grounded, not to be overwhelmed by thoughts or by emotions. Yeah. If there's no shift, I would like to have an interview really on that, to know whether they can, what is the shift they're looking. And then I would go to positive affirmation, I would go to chanting, or just be there to hear what they need to feel. Yeah.
Thank you again so much, Evie, for your beautiful presentation. Thank you for your questions. We do have to move on to the next presentation. So we thank you for being here this morning.
Thank you very much. Very, very much. Thank you.
Thank you.
I hope you have a great time, great successful presentations for everybody to enjoy and learn and stay connected.